Okay, Reish Samech Bet, Hilchos Milah. Okay, we're continuing with Bet. I just want to point out when we're talking about days, I think it's pretty obvious. It depends on where you are. Wherever the baby is born, you look at the daytime based on what the hours are, and then wherever the Milah is, you look based on where the baby is, because one can travel from one location to another, and it doesn't, you don't go by the Zman of where the baby was born necessarily. For the birth you do, and then for the Milah, you go by where the Milah is. You don't look at the hours, from, let's say they moved after day 5 from America to Israel or whatever it is. The hours are could be 10 hours easy. So then you don't look at the time change, and you count the days, obviously, by the baby's days. Eighth day from the birth. So that's just to clarify. Bein Hashmashos, I did see that in Psakim Machuvos, he writes he seems to write that even if they're getting ready to do the Milah, or they're starting to do the Milah near Shkia, and then Shkia passes, then once Shkia passes, you stop and you don't do the Milah until the next day, even if it's 5 minutes after Shkia. So ask your Rav, your Mohel, whatever, what the psak is. I think. We're going to see when it comes to we're about to get to Bein Hashmashas. We'll see that nowadays, for the Lamaisa, basically every Jew across the world says the day ends at, general minhag is, the day ends at Shkia, which is sunset, the astronomical sunset that most of us are familiar with. Even Hasidim or Ashkenazi Jewry, who many of them used to follow Rabbeinu Tam and go way after Shkia in Europe. Nowadays, the accepted custom is we go by what we call sunset. However, there will be some Hasidim who will give you maybe an extra 10, 15 minutes to count that as part of the day, even if it means doing the Milah on Shabbos. So we're going to get to there, but I just wanted to point that out. And we're going to see that Amud HaShachar is not the same as Bein Hashmashas. When we started learning about Amud HaShachar, let's say 72 minutes. Again, that's a bit of a question, but we'll call it 72 minutes before sunrise, the astronomical sunrise. So there we do hold it's Vada Yom. It's 100% daytime, and it's 100% Yotze if you did the Milah starting then. And no one says to do a Tafas Tam Bris. Again, you don't do a prick and nothing like that. So just, it's not Lechatchila. Okay, Lechatchila, we definitely wait till sunrise. However, when it comes to Bein Hashmashos, that's a real suffix. We really don't know what that is. Either we don't know what it is, or that Zman has no real definition. However you define Bein Hashmashos, it's 100% halachic suffix, and so that's a major difference. Also, here I'll just jump to the gun a little bit. We're going to see that it's in Reish Samech Bet. There's a big Vilna Gaon, very famous piece of the Vilna Gaon regarding Seisa Kochavim and Bein Hashmashos. It's worthwhile to read, but anyways, it's a bit of a complicated topic. So, you know what? Let's get to read a couple of seifim, and we'll see that. We'll see how that plays out a little bit more when we get there. Fine. So let's start with Bet inside. Kole ein malinoto ad sheyavri. All right. Now, if a baby is born is sick, it could be born sick, it could become sick, but when it comes to day 8, the baby is sick. So we don't do a bris milah on a baby that's sick. Umamtinin lo me'eit shenitrape mechoyo shivat yamim me'eit le'eit. How does it work? We wait a full 7 days, but it's me'eit le'eit. So a day is 24 hours. So whatever it is, it's 7 times 24 hours. Right? Whatever daytime we decide the baby now is healthy, we add on a full 7 days from the exact same time. So often often people might talk about it like 8 days or the 8th day. Again, it's partially true, but the technical is 7 times 24, right? That's when we wait. All right, you don't do it in that morning. You have to wait till the same time 7 days later. No, from when he got healthy. If a baby is unhealthy, however long is unhealthy, hopefully not long, whenever the doctors say now he's healthy, then you add 7 days. You know what? Let me stop right now with a little short story. I was listening to a Shiva Rav Leibowitz. He had a nice story. The question was, there was a lady who, let's say, I think she was having some kind of cancer therapy or needed to have chemotherapy, but she was pregnant. So I guess they pushed it off a little bit. The baby was very premature, and then needed to have, I guess, some kind of steroids or drugs, whatever the medication, in order, whatever the situation was. But the question at hand came when the baby was considered healthy, and it was supposed to be, let's say, we call it after 7 days or the 8th day, whatever it is. That's how the question was posed. But for whatever reason, that's not the point. The mother was not able to be at the bris if it was going to be on that 8th day, or 7 days times 24, because she couldn't leave the hospital and the baby couldn't have the Milah in the hospital, whatever it was. That's the case. Question is, can the Milah get pushed off a day? We already learned a Milah shelo bizmana. So you wait till it gets healthy. You don't do it on Shabbos, or we're going to see. But every day there's a din, you can't push it off. So what should we do? So the father asked his Moel, Pesach Kron, and he said, no problem, push it off a day. So, or it'll be we'll do it the next day. I don't know this terminology. I don't think he would say push it off when you hear the end of the story, but he says, do the bris on the next day and the mom can come and no problem. So then the father calls Rabbi Leibowitz and he says, I don't know what Rabbi Kron was saying. Was he saying that because I sound like a Baal Tshuva and he was afraid that if he doesn't do it the next day, I'll go to a different Moel? Or was he giving me a proper psak that, yeah, for the mom, you can push it off a day because it's shelo bizmana? So Rabbi Natan Leibowitz, so in the story, he tried to ask Rav David Feinstein. He wasn't available. Then he finally asked a different Rav, and he told him, no, you can't push it off because it's usher to push off. Even if it's shelo bizmana, it's usher to push it off a day. So he said you should tell the mom that bizchut not pushing it off. You should do it on time. I'm getting a prat. I apologize. A prat of the story. And who said what? He got a psak not to push it off. He also got another psak from a different Rav who said to push it off. The idea was pikuach nefesh for the mom. He got a couple different psakim. Which one to do? Rav Zilberman Steen and Bnei Brak. So he said no. You tell the mom also not to push it off, but make sure you get a Zoom. And then he got back in touch with David Feinstein. He said, no, you shouldn't push it off. So both of them said not to push it off. Anyways, he got a couple different psakim, and then he was like, now who do I follow? So this was in his whole, more of a lengthy shir but really the real shaila really was who owns the shaila and who owns who's on the baby. It's the father. So Rabbi Leibowitz's real question wasn't really much of a question. Who should he follow? Because he started asking numerous rabbis. And it could be he was just asking for interest. Not necessarily a psak, but I think he was. But anyways, that's not the main point is, so finally now, right, we all would have done it first. Now he calls Rabbi Kron on the phone, and he says, this is the story, and I want to know, the father wants to know, what was your psak? Was it a psak, or was this you were afraid to lose the bris? And maybe he'll go to a conservative. Not that he needs the bris, but he's afraid he might go to a conservative rabbi, a moel, whatever. So he says, no. Whenever I say something, I gave a real psak. And he says, I also would say not to push it off. The reason why I said to do it the next day was not because I said you can push it off. Now again, every case has to be done legufo. There could be a real case of pikuach nefesh, of a person, if they really are sick and it could make a difference. Anyways, but for the sake of the story, no. He follows. The point was he learned the psak of Milah from his rabbi. He held that whenever a baby's taking medication for a sickness, again, it probably depends which medication, ask your Rav, but basically the story is, whenever you're taking medication, we assume you're not healthy. So normally, I think what Mo'alim and Rabbanim do, can't speak for them, but I believe, you go by when the baby's considered healthy. And right, the doctors, whatever, you consider them healthy. And then you count exactly 7 full days from now, right? 24 times 7. But his psak was, on the day you're still taking medication, I'm assuming not Tylenol, maybe something like steroids, whatever it is, that day, if he's still taking medication, the fact that he's taking medication, we assume he's still sick. And so he holds, you start counting the 7 days from the next day. So it worked out well for the mother. Again, he wouldn't have pushed it off 2 days because he wasn't pushing it off for the mom. He was pushing it off. Anyways, so it's a little bit relevant to what we learned yesterday and what we're learning today. Like we're going to see, I saw in Psakim Lechuvas for antibiotics. And so I discussed it throughout Pesach. Antibiotics, so I spoke to Pesach and Psakim Lechuvas. He writes, you don't go by finishing your dose of antibiotics. I mean, we all know that many times a person is considered healthy after 2 days of taking, or 3 days, let's say, of taking medication. Antibiotics, often you'll see no difference for 1 or 2 days. You have to give it 2 days to really know it's not helping, as a general rule. Usually within 1 day, but it could certainly be 2 days. But certainly by 3 or 4 days, the person can be completely healthy. I mean, you're still taking antibiotics because the general regimen that's given usually is for, let's say, 5 or 7 days. And we always say, keep taking it so that you finish with the bacteria being killed or whatever it is. So it doesn't create a super strain. Exactly. But it's not because you're still sick. It's for the sake of not becoming sick again later from let's say a super strain or whatever it is. So therefore, you don't count from, I don't know if anyone says stop counting from antibiotics because you could be healthy and you're still taking antibiotics. But anyways, whatever the psak of becoming healthy, that's what we go by. Bameh, or whatever you're of and how you define. Bameh devarim amurim shechaltzato chama. Basically, one has a fever. Because their whole body is affected by it. That's called the whole body is sick, and you wait 7 full days. Right? 24 times 7. Uchayotze bo shehu choli shebechol haguf. If it affects the whole body. But if it only affects one limb, we're going to see a small pain in the eyes. So that's not called where your whole body is sick. So then only if your whole body is sick, or we're going to keep reading. So then you wait a full 7 days. But if it's just something minor, we're going to see more as we keep reading. Mamtinim lo ad sheyavri. So then all you need to do is just wait till the baby is healthy. Sheyavri malin oto miyad. And as soon as he's healthy, then you circumcise him immediately, right? Even the same day. Aval ke'evo lo einav ke'ev gadol. But if you have very painful eyes, have kecholi shebechol haguf. So then that's considered a choli of the whole body. And then you wait a full 7 days. I'll just quote a little bit. This is mostly from Psakim Lechuvas. I'm just assuming most would agree that basically, he writes, what do we call ke'ev einayim gadol for the eyes that we wait 7 days? That's if they're very red or there's separation pus coming out. But if it's just a little red, then you would do it right away.
It's not a holy at all?
Well, so it could be, then it is a holy, well, it depends on how you define a little red or pink, but if it can be considered a little bit sick, and then you would wait.
Do we know what jaundice, the yellowish?
Yeah, so we're going to get to jaundice in a minute. Here, I'll just point out. So if you look in, you don't need to, but you can look in the Shach or a couple places, he points out that if, this is the halacha, again, ask your Rav or Moel at the time, but if the baby is having some kind of pain and some kind of a sickness or pain and he's uncomfortable, so the halacha is we wait until he's comfortable, even if he's not really sick, because we're afraid the fact that he's having pain for some reason, or he has some kind of a condition or some kind of a wound, then we're afraid that it can lead to a sakana. So in general, if the baby is suffering, even though they're not sick, we wait until they get better. And then you can do it right away. That's the general rule. He just quotes from Psakim here. So generally, broken legs and bruising from birth. So again, depends on the case. You'll probably wait till he gets better, but you certainly do not wait 7 days. That's not holy kol guf. He says, here, I'll do this afterwards. Temperature. So his rule for temperature that you have to wait 7 days for is, he writes, 38 degrees Celsius, so that's 100.4 Fahrenheit. Or if it's below 36 Celsius or below 96.8. A baby has trouble breathing and they're on oxygen. So he said, again, it really depends on the case. He writes you wait 7 days, but I'm sure it's check with the doctor. All these things you have to check really what's the condition, what's causing it. If the baby has a blood transfusion for, high bilirubin or whatever it is, probably you would wait 7 days, he writes. If it's anemic, so if it needs real treatment, you'd wait 7 days. But what we normally hear about is just a little bit, and it's called jaundice. It's a little bit yellow. So then we just assume that the baby's blood or whatever the condition isn't fully developed. It's not considered a sickness. And then as soon as the baby is ready, the color comes back to within normal or close enough. So then you don't have to wait at all. You do it right away. Okay. While he's jaundice, so you wait, exactly. But as soon as it goes away, again, depends what level of jaundice. But yeah, how mild, how moderate. Okay. Now, for premature babies, so generally he writes, normally we wait until they are at least 37 weeks, a full 37 weeks from pregnancy go by. So then that's okay. In other words, if it was born before that, so you wait till the baby's 37 weeks. That's the general rule, he writes. Again, that's and just the beginning of the 38th week is generally okay. Obviously, you have to check the baby. And well, the way he writes it was once it's the 38th week, whatever, ask. The 7 days is really, I think, to know that from sickness. If the baby's healthy at week 36, I think everyone would agree in 37, you're good to go. After 37 is complete, then you're good to go. Because the baby is not necessarily, premature doesn't mean it's unhealthy or sick. It just, it's not quite ready. So that's, anyway, ask your Rav. Baby incubated. So then Igros Moshe and the Tzitz Eliezer says you wait 7 days. Again, depends on the case, but let's see. He writes, if a baby falls 10 tfachim, God forbid, ask a shayla to make sure the baby's healthy. If the baby's not nursing, again, find out why they're not nursing. You might have to wait 7 days. Generally, most poskim, he writes, say weight itself is not necessarily a factor. Weight on its own to see what's going on with the baby itself. But so he says most would give, even if it's less than, just as an example, 2.5 kilo or 5.5 pounds. If the baby's completely healthy, according to the doctors, you wouldn't wait. But some do wait and say it needs to be at least 2.6 or 5.73. Anyway, just something, general knowledge. Okay, let's keep reading inside. Yeah, just a bit more. Gimel. Androgynous. This is a baby that has both male and female genitalia. Or he has two oralot. That either means two layers of foreskin, or it means he has two actual ivarim to do an orla on, two separate ones. So either case, or a viyotze dolphin, or a C-section, cesarean comes out this, right? We're familiar with that. Nimolim lishmona. All of these cases, you don't do it before the 8th, and you do it on the 8th. Right? We're assuming that, again, this is a new category. We're not sick, and so there's no reason not to do it on the 8th. But we don't do these cases on Shabbos. So that's kind of where the case comes from, because there's a comparison or a question in the Gemara. But okay, so for Shabbos it's not docha. We'll see when we get there. But for our purposes, we do it on the 8th day. Let's do one more. Dalid. No lad bein hashmashas manimo mehalayla v'nimo l'tishii shus mehalayla. So as soon as the baby, once it reaches, we said this, we started to talk about this, once it hits after sunset, then the shkia is over, and it starts bein hashmashos, and that is, we call safek, and therefore, we count from, and that's already counted for the nighttime. So that it's so in other words, it's the 8th day from the next day. You don't count Bein Hashmashos as the day, you count it as a nighttime. So they now, it's either 8th or 9th day, depending on what you're counting from, but it's the 8th day from that night, but it's still on a case of a suffix for Shabbos. It's not Docha Shabbos, we'll see. V'motzi Rosha Chutz Afrozdor, מבעוד יום, או ששם אותו בוכה אפילו נולד אחר כמה ימים, מונים לו 8 ימים מיום שיצא ראשו, או מיום ששמו אותו בוכה. So, and once it comes out, either most of the head, which is most of the forehead, or if it would be a breech birth, right, or a kuz in Hebrew, then it could be legs first, it could be then you go after rove gufa, rove of the body. So it's either, if it's the head first, normal, that's most of the head, most of the forehead. But if it's a breech, then it's most of the body. Or you even hear it crying, because we assume that the baby's mouth came out and went back in. If you can hear the baby cry, then that's the assumption. And so therefore we assume it was already born. Since it was during the day, then that's when it is. It's 8th day from when that happened. Okay, davka bistam. That's normal, right? If the woman didn't say anything about labor pains, then crying we assume is for sure that it came out. Aval in imo omeret shetinok haya munach bebitna kamo b'sha'ar pa'amim v'lo haya lechev le'leida klal. If the woman tells you, again, don't ask me how this is possible. If the woman tells you, I know for sure I had no labor pains and no baby was coming out, and I felt 100% the same as always, then we believe her, maybe Vada, maybe Safek, we believe her that it didn't come out, even though we heard the baby cry. I guess it was crying from inside the womb. Or maybe, I don't know, baby from next door. Maybe it was a baby from next door. That'd be more common in the hospital. Who knows? Even though it's not so common, right, until the baby comes out, until it comes out. But Lamaisa, we believe the mother. Lomar shahaya munach kamo b'shar pa'amim ubacha. We believe her that it didn't come out. And I'll just point out from the Gra real quick. Yeah, so he talks about it. He points out that when it comes to nighttime, it doesn't go by the sky, it goes by stars. And we have Fritzesa Kochavim. So, and it's in the morning, it's the opposite. The Amud HaShachar, it goes by the light of the night, and it has nothing to do with the stars. Right? I think we're all familiar with that. It's just interesting how he puts it in that comparison. And he says that, right, he holds 100% that our astronomic shkia is the shkia, and it's only 13 and a half minutes until Tseis Vadai for halacha, right? And that's the real tzeis is 13 and a half minutes after Shkia, but he points out that the time of 13 and a half minutes or 72 minutes in the morning, maybe, whatever it is, he writes that that's all based on Eretz Yisrael and based on a day that's 6 to 6. If, obviously, now we're in the summer or it's in the winter, then that 13 and a half minutes can become a little bit shorter for Tzeis, or it could be a little bit longer. 20 minutes is for sure going to be fine for all year. So anyway, but that's for Eretz Yisrael. And if you're in a different height, right, in the horizon, whatever, the latitude, so then things change a little bit accordingly.